Welcome to another Healthy Living presentation brought to you by Massey Cancer Center's Integrated Health Program. I'm Dr. Susan Chandler, and the topic for today is sleep. Sleep throughout the cancer experience, common problems and potential solutions. Our speaker is Autumn Lanoye, a research scientist with Massey's Survivorship program, and also a clinical psychologist who specializes in helping people make lifestyle changes while coping with illnesses like cancer. This talk will describe common sleep problems experienced by people before, during, and after their cancer treatment. In addition, Dr. Lanoye will describe strategies for improving sleep, as well as resources for addressing sleep difficulties. This presentation will be recorded, so if you do have questions, please enter them in the chat box. At the end of the presentation, these questions will be addressed. Thank you for being with us today, Dr. Lanoye.
Of course. Thank you so much, Susan. Thank you for the introduction and the invitation. I'm so glad to be here and to be able to talk about this topic on our Facebook Live. And like Susan said, if you have questions as you're watching, pop them in the box and we'll get to those at the end of the presentation. And so just to kind of orient you all a little bit to how I approach this talk, I am, as Susan mentioned, a research scientist. I'm also a clinical psychologist. My lens for this talk is mostly based on my clinical experience. So working with people who have cancer at all points of their cancer trajectory and working with them on improving their sleep. So there's a little bit of research mixed in, but this is kind of a big picture, bird's eye view and kind of findings from my interactions with patients throughout their cancer trajectory. And just an overview of some of the topics we'll be covering. So before we talk about sleep difficulties and sleep problems, I want to be sure that we talk about and have a good understanding of what quality sleep is, so what a good night of sleep looks like. I'll then move into common sleep disorders that we see in people at different stages throughout their cancer experience. And then specifically the sleep problems that people encounter before, during, and after cancer treatment. And then where I want to spend most of my time, I'm very solution strategies focused, is on strategies and tips for helping to improve sleep. And then additional resources for addressing sleep difficulties if this is something that you're interested in and you're looking for more resources or kind of next steps for you to help improve your sleep. So quality sleep, what does it look like? One way we can think about sleep quality is in terms of sleep duration. So the length, how long, how much sleep you're getting each night. And there are different recommendations for different age groups. So ages 8 to 60, the recommendation is 7 or more hours per night. Ages 61 to 64, the recommendation is 7 to 9 hours per night. And ages 65 and older, the recommendation is 7 to 8 hours per night. And actually, one of the common sleep myths that we see is that our need for sleep declines as we get older, which isn't true. So you can see that the recommendation from 18 all the way to end of life is really about 7 or so hours. So even into your late 60s, 70s, 80s, your body's need for sleep and the best restorative sleep is between 7 and 8 hours. But what happens is it becomes more difficult to achieve that sleep. So you might experience sleep problems more often, waking up early, waking up throughout the middle of the night. That doesn't mean that your body needs less sleep. It means that you're experiencing problems and things that are barriers in getting that sleep. Another indicator of quality sleep is that you're able to fall asleep within 30 minutes of getting into bed. So the time between getting into bed and falling asleep, there's a large range and variety of what that looks like for different people. But 30 minutes is kind of the threshold or cutoff for what we consider good sleep quality. So thinking about getting into bed and then falling asleep. And then in terms of waking up in the middle of the night, good sleep quality is associated with maybe waking up 0 to 1 time per night. Anything more than that might be indicative of sleep disruption, sleep disturbance, or poor quality sleep. And then if you do wake up, an indicator of sleep quality, sleep health, is that you're able to fall back asleep within 20 minutes if you do wake up in the middle of the night. So if you wake up at night and you're tossing and turning, awake for more than 20 minutes, up to hours, that might be an indication that you have a sleep difficulty or a sleep disruption as well. So these are all indicators of quality sleep. You can kind of reflect on what your own sleep has looked like over the past week, the past 30 days, see how many of these criteria you've met, and kind of get a good idea of what your own sleep quality looks like. And then the last one is feeling rested and energized upon waking in the morning. So kind of taking stock on how you feel when you wake up. If you've, met your sleep duration, if you've stayed asleep throughout the night and you're still waking up feeling not well rested, not energized, still groggy, that might be another indication that you're having some type of sleep difficulty or sleep disruption. The benefits of quality sleep. If there's one thing that research agrees on, is that quality sleep has a number of health benefits for people without a cancer history and especially for people with a cancer history. And so quality sleep is a critical mechanism for maintaining optimal functions of a number of different systems in your body. So immunity, your endocrine system, your metabolism, even on a cellular level. All of these things are affected by the quality of sleep that you're getting. So really everything kind of resets when you're sleeping, regenerates, restores, and your body kind of sets itself up for the next day on all of these different physiological levels. But then we also know kind of day to day, these might be the ones that we're more familiar with. Quality sleep helps in terms of your ability to think clearly, concentrate, focus, think quickly. If you think of yourself on a good sleep day compared to a poor sleep day, just noticing that difference and how efficient you are with things like problem solving, multitasking, all these things that have a really high cognitive demand, the amount of sleep that you get and the quality of sleep that you get really has an impact here. And especially thinking about the cancer experiences where people might be experiencing chemo brain or other cognitive difficulties as a result of their treatment. If you're getting poor sleep on top of that, those cognitive effects might be compounded and made even worse by a lack of sleep. And then, of course, sleep affects our mood and our stress level. So, poor sleep is linked with not only poor mood the next day, but chronically poor sleep can be linked to the development of depression. And those mood, stress, and cognitive effects can affect our behavior the next day as well. So, how we're feeling emotion wise might affect our decisions on what we eat, the nutrition components of what we eat, whether we're physically active. So sleep has all of these ripple effects, and as far as other health behaviors and our mood and cognitive state. So really, sleep is a great place to intervene to have kind of ripple effects on all these other domains. And so some of the most common sleep disorders we see it, with people who have a history of cancer or currently going through cancer treatment. One is sleep apnea. And so that is caused by interrupted airflow during sleep. So you might notice things like snoring, gasping, waking up feeling like you're out of breath. If you're sleeping with someone, your partner might notice these things more than you, so they might be a good person to check in with and get a snapshot of whether you're waking them up with some of these snoring or other breathing difficulties. And you also might notice excessive daytime sleepiness with sleep apnea. So even if you're in bed and you're asleep for 7 hours, the interrupted airflow really does affect your sleep quality in a way that you might not necessarily notice. And you might notice the effects because of this excessive daytime sleepiness the next day. Another common sleep disorder that we see among cancer patients is restless leg syndrome. So this is characterized by an urge to move your legs and an uncomfortable or unpleasant sensation in the legs. And some people liken it to like ants crawling up and down their legs or just kind of like pins and needles all throughout their legs. Other factors is that it occurs during rest. It's relieved by moving your legs and it worsens at night. So that's why it's kind of considered a sleep disorder because it happens when people are trying to fall asleep at night. And then lastly, what is perhaps most common and what perhaps people are most familiar with is insomnia. And so this can be difficulty initiating sleep. So getting in bed and finding that it takes, hours or more to fall asleep. It could be difficulty maintaining sleep. So waking up multiple times in the night, waking up maybe only once in the night, but finding that it takes hours to get back to sleep. Or waking, being able to fall asleep, maintain your sleep throughout the night, and then waking up at 3 a.m. and not being able to go back to sleep. So, any of those patterns of sleep disruption can be characteristic of insomnia. Some people might experience one, some people might experience all three. So, it can look different for everyone in terms of the profile of sleep disruption. And for a diagnosis of chronic insomnia, what we're looking for is any number of these difficulties on at least 3 nights per week, lasting for at least 3 months. And that really cues us as psychologists or whoever is evaluating this that really this might be a chronic problem. And then other things to keep in mind with insomnia is that it occurs despite opportunities for sleep. So it's not like, you're spending the nights engaged in other activities. You're actually trying to get to sleep and they're having trouble. And that it causes distress and impairment in your daily life. So it's not as though you're getting 4 hours of sleep tonight at night and you're facing the day refreshed and everything else is normal. So the lack of sleep is really causing impairment for these people who are suffering from insomnia. And this is a common model of how insomnia and sleep disruption in general develops over time. And we'll be revisiting this a couple times throughout the presentation. So I'll spend some time here. But if you think of this line here as the threshold for insomnia, so anything below that threshold, you might be having some sleep issues, but they don't meet the criterion for insomnia. And everything above it would be indicative of insomnia. And there are three main factors that we consider. So we'll start down here with predisposing factors. So these are things that might make us more vulnerable to sleep difficulties. These are things that are typically outside of our control. They might include genetics, they might include age. Some studies have found that females are more predisposed to sleep problems than males. But generally, these are things that remain stable over our life. And just, when they're greater among some people, it means those people are more vulnerable to developing sleep problems than for people that have lower predisposing factors. So those are kind of stable over time. And then what we really consider is these precipitating factors. So this is what typically spikes someone into above insomnia threshold. Precipitating factors are stressors. So we've probably all had this experience at some time in our life, whether it's due to stress at work, stress at home, changes in life, anything you can think back on and you're like, wow, I've had a really bad run of sleep for these past couple of weeks. I've been up late, things have been on my mind, it's been hard for me to fall asleep. And those are, can spike you up into the insomnia threshold. But what we typically see is that once the situation resolves, so once you gave your presentation at work, or you've moved and you've kind of settled in and the initial stressor has disappeared, we find that for the most part, people are able to kind of get back on track with their sleep schedule. So that's kind of this line here. The precipitating factors peak. You might have a couple of days or a couple of weeks of sleep difficulties, and then that kind of naturally reduces with time and with resolution of whatever was initially causing you stress. And where we get into trouble and where we get into chronic insomnia is with what's called perpetuating factors. So these are things that may have initially started as attempts to cope with this sleeplessness that was caused by the precipitating factors. So it could be things like napping throughout the day. It could be things like excessive worry about getting enough sleep. It could be things like starting to watch the clock to make sure you're getting enough sleep. And these factors are tend to continue even after the initial stressor has reduced. So what really sustains chronic insomnia are these poor sleep habits that we've developed that were initially meant to help cope with the initial loss of sleep, but eventually serve to kind of perpetuate poor sleep over time. So we'll talk about each of these a little bit more in detail as we talk about how things might change over the course of the cancer experience. But this is kind of the model for how insomnia might typically develop. One thing I want to mention is the difficulty of sleep research. So there's a lot that we don't know about sleep in general, and there's especially a lot that we don't know about sleep as it relates to cancer, and that's for a multitude of reasons. So sleep isn't just one construct. There are a lot of things to think about when we think about sleep. So one of those we've already mentioned is sleep duration. So the length of time that you're asleep. Also sleep quality. So there are different stages of sleep. So you might be familiar with REM, rapid eye movement. That's the stage of sleep that's most restorative. And then throughout the night, you're constantly phasing in and out of deeper and lighter sleep. So those phases are important to think about as far as sleep quality. Sleep efficiency is the time spent in bed compared to the time that you're actually asleep. So if you're in bed for 8 hours and you're spending 7 hours and 45 minutes asleep, that's great sleep efficiency. If you're in bed for 8 hours and you're spending 4 hours asleep, you're at 50% sleep efficiency. That's a sign that you might be having sleep problems. And that's also something that's studied in research. It also might be variability in sleep schedule. So even though say you're getting 8 hours of sleep every night, that's fantastic. If you're sleeping from 12 a.m. to 8 a.m. during the week, so Sunday through Thursday, but then sleeping 3 a.m. to, if my mental math is correct, 11 a.m. on weekends, you're still getting that same 8 hours of sleep, but it's shifted in time. And so that shift over time is actually associated with the development of cardiometabolic risk. So even though you're getting the same amount of sleep, that shift in sleep time can have independent health effects. So that's also another area of study. So different sleep researchers have different areas of interest. There's a lot of different considerations when we think about sleep, and all of these make drawing conclusions about sleep that much more complex because different people are looking at different things. Um, Other things that affect the quality of our research regarding sleep is that people tend to be poor historians about their sleep. So if you're asking someone to describe their sleep, they might be able to tell you pretty well how they slept last night, what time they went to bed, what time they woke up this morning. Um, but it's kind of hard to assess what time we fell asleep and what time we woke up ourselves. Um, and then the farther out you go, if you're asking people to recollect their past week, that gets harder the farther back in time you're asking people about. Um, Formal sleep studies where we bring people into the lab, hook them up to EEGs, and really get a good analysis of all those phases of sleep. We're really able to accurately assess sleep and wake time. We're able to observe what's happening at all stages of sleep throughout the night. They're time consuming, they're expensive. And really, when we're thinking about a cancer population, it's really hard for researchers to be able to balance that burden, the knowledge to be gained from that type of study, balancing that against the burden that people with cancer are already facing when we're thinking about going through treatment, coping with all the other changes that are going on in their life. It's really a significant burden to ask them to come into the lab one or multiple times for these types of studies. So it's really important to, as researchers, think about the knowledge that we're gaining from these types of studies and whether it's worth that additional burden to ask people to come into the lab and participate in these types of studies. The good news is that we have a great in between of self-report and a full lab study. So wearable devices. So if you have a Fitbit or other similar things, you might know that it kind of gives you some good information about your sleep. We in the research world use kind of just a souped up version of that. We put it on your wrist. You can wear it for a week and it lets us know how much time you're spending in physical activity, how much time you're in bed but not asleep, and how much time you're sleeping. So, and then we can analyze the data that we get from that little watch. So that's where things are kind of headed. That's kind of a good balance between burden and good data. So moving forward, I think that a lot of what we know might come from these wearable devices. One other thing that is difficult in sleep research in a cancer setting is the difference between sleepiness versus fatigue. So these are overlapping constructs, but they are a bit different. And cancer-related fatigue is a really common experience for people with cancer, even before treatment, and then especially throughout and after treatment. It's more intense than what other people might experience as fatigue. It's different than tiredness. And one of the key distinctions is that resting and napping typically offers little to no relief from cancer-related fatigue. It extends beyond tiredness into actual physical weakness. So arms and legs might feel heavy. You might feel like you're exerting so much effort even to do normal daily tasks. You might be feeling drained. feeling difficulty concentrating or focusing thoughts. So it's kind of above and beyond sleep, but it's very easy to kind of conflate with feeling tired or sleepiness. So this is another thing that researchers have to kind of figure out how to tease out, and how to target sleep and how to target fatigue. How might those look similar? How might they be different? And how might you get different results from targeting these different constructs? Okay, so thinking about what sleep disturbance might look like at different points throughout the cancer experience. So, prior to cancer diagnosis, there's a lot of research and a lot of mixed evidence for whether short sleep, so chronically short sleep, so people getting less than 6 hours of sleep a night for prolonged experience of prolonged periods of time, or long sleep, so 9 or more hours a night for long periods of time, um, might increase risk for certain types of cancer among certain types of populations. But again, because there is so much to take into consideration with different types of cancer and how sleep might operate to develop those different types of cancer, there's a lot of research interest here, but there's also a lot of mixed evidence. So the jury is kind of still out as far as saying, this is definitely a risk factor for this type of cancer. But that's definitely an area that's being heavily researched. What, you know, research consensus has been the strongest about is exposure to light at night. So the World Health Organization actually considers prolonged exposure to light at night as a probable carcinogen. This is seen in people who do shift work, for example. If you're awake and exposed to artificial light, from midnight to 8 a.m., when your body intends to sleep and expects sleep, if you're awake and active and exposed to light, that can actually disrupt your circadian rhythm. So your body has its own 24-hour clock, which is which responds to cues in the environment. So when it's light outside in those early dawn hours, your body is activated. During daylight, your body is in an active state. And then when it starts to get dark out, your body gets ready for sleep. So your body has its own 24-hour cycle, which responds to external light cues. So when you're artificially altering that by getting a lot of light at night, it confuses your body, and that has downstream effects on hormones, metabolism, cell division, and proliferation. And so that's where we really see the risk for tumor development or exacerbation on that cellular level. When we're thinking about sleep disturbance after a cancer diagnosis, I can't think of a more classic example of a precipitating factor. So, the stress associated with a cancer diagnosis, the emotions associated with a cancer diagnosis, depression, anxiety, worry, anger, all of these things serve as precipitating factors that might spike people up into that insomnia threshold. There might also be changes in your routine. So you might be not working, you might be working and trying to attend doctor's appointments, you might be dealing with friends, family, loved ones coming in and out of your house at all hours of the day, wanting to make sure that you're doing okay. So there is so much going on after a cancer diagnosis that might kind of lead to crossing that insomnia threshold. Um, and one thing that I hear or heard a lot from people coping with this during their cancer experience is that, during the day, there were a lot of distractions. There were doctor's appointments, someone was always with them, friends, family checking in. And so it was really only at night that they had the time to kind of sit alone with their thoughts and kind of process their experience. And that could kind of keep them up for hours at night. And even just things like feeling unable or not sure how to have those conversations with friends and loved ones during the day, feeling kind of alone in that experience and kind of being isolated. And really, sometimes the only time they got to themselves was at night before bed. And so that's when kind of those thoughts, concerns, questions would really be on their mind. And so you can see how easily that might lead someone into kind of tipping that balance over the insomnia threshold. So then moving on to during cancer treatment, there are just physiological, biological effects that things like chemotherapy, radiation, and hormonal treatment have on a biological level that might heighten your predisposing factors to sleep difficulties. So the treatment you're receiving for cancer might make you more vulnerable to sleep problems, even, setting aside the immense stress that people might be under during this time. So those operate on a biological level, again, are outside of our control, but things to keep in mind during your cancer treatment and things to discuss with your doctor if you're noticing these things during cancer treatment. And kind of research is ongoing on how different types of treatment might affect your sleep biology and how long those effects might last after treatment. Those are still question marks and areas of ongoing research. And then when we think about sleep disturbance into survivorship, obviously survivorship begins at diagnosis, but even thinking about what classic survivorship or surveillance phase, cancers in remission, you might not be in active treatment. You might not have some of those constant worries about, what might treatment look like because you're past that. Things might be returning to normal as far as your daily routine and schedule, but that's where those perpetuating factors come in. And so people experience fear of cancer recurrence, people experience depression, anxiety, even, past their immediate treatment, and that can last for years afterwards without additional treatment, specifically for those issues. And they also might be experiencing things that helped them sleep during the treatment experience. So some people during treatment may have found it helpful to fall asleep with a TV on, and that's what worked for them during treatment. They might continue that habit even after treatment. Things like naps can be helpful during treatment because sometimes your body just needs more sleep during treatment because of those biological impacts that treatment is having. But that might lead to continuing those naps after treatment is over when you might not necessarily need those. So when we see people who are, 5-10 years out from treatment and are still experiencing chronic sleep problems, we really want to investigate those perpetuating factors, which are mood, thoughts, and behaviors surrounding sleep that might be contributing to ongoing sleep problems. One thing that I also want to bring attention to that we often don't consider as much as the patient experience is the amount of sleep disturbance and the distress associated with that for caregivers. And so insomnia is one of the most common and most distressing experiences among caregivers of people with cancer. And caregivers can experience insomnia at rates far higher than the general population. And in some studies, they have found that caregivers actually experience insomnia at rates higher than the cancer patients themselves. So that's really something to keep in mind as well, whether people who are watching are caregivers themselves, are people with a cancer history, or are providers, making sure that we're checking in on the caregivers and their experience with sleep as well, especially because research shows that the patterns of sleep between patients and caregivers are very interrelated during treatment. So, in one of those studies where we gave people those wrist worn devices to measure sleep over time, we gave them to both patients and their caregivers. And over treatment, that we saw decreases in sleep quality among both patients and caregivers in kind of parallel. So they're very related. But on the flip side, that means that caregivers can have a positive effect on patient sleep by modeling good sleep habits, which we'll get into in a little bit. But that kind of works both ways. So they can both kind of decrease in sleep quality together, or they can both potentially increase in sleep quality together. So thinking about caregivers and their role is also an important factor when we're thinking about treating sleep disturbance among people who have cancer. Okay, my favorite part. Tips to improve sleep quality, strategies, things that you can do at home. So the first is setting a routine that prioritizes sleep. So this is a little bit different than how we typically operate. We normally arrange our schedules around the things that we're doing during the day. What needs to get done, going to work, making dinner, doing things around the home, spending time with family. We're typically focused on how we're spending our waking hours. But if you're having sleep difficulties, I would challenge you to think about how you can schedule and prioritize your sleep routine. There are a number of ways to accomplish this. So, one is to work towards having a fixed wake up time, regardless of whether it's a weekday or a weekend, whether you have work the next day, whether you don't have work the next day. Again, because we see from research that even if you're getting the same amount of sleep, that shift in sleep timing can have negative impacts on your health. And it can also prompt sleep difficulties during the week if your sleep schedule is significantly different during the weekend. Following a nightly wind down routine. This can look different for everyone, just depending on what helps you. It could involve taking a warm bath. It could involve, you know, other relaxation, yoga, reading, journaling, even just putting your pajamas on, brushing your teeth, washing your face. That can be a kind of your wind down routine in and of itself. But you want to follow something that lets your body know that you're preparing for sleep, because your body will respond to that. It kind of habituate to that cue. So you want your body to learn that, when I do this sequence of things, sleep comes next. One that most people know and most people find so hard to successfully achieve is to stop using screens, so TV, laptop, and phone, before you begin that sleep routine. So not only the light activation, but just the mental activation associated with what we do when we're watching TV or on our phone can really interrupt our falling asleep and staying asleep. So before you start your sleep routine, you want to turn off screens, put your phone on silent, set your alarm and kind of try to forget about it. Having a plan or a schedule prepared for the next day. Sometimes when people are in treatment or even afterwards, if they've had to significantly change their schedule. Some people have had to cut back on work. Some people aren't working at all anymore. So when you have a lot of free time, it's easy to press snooze on the alarm because you're like, oh, I don't really have to get up for any urgent reason. I can sleep for longer or lay in bed for longer. But thinking about what's going to get you out of bed the next day at your wake time can be helpful as well. And this might seem overwhelming. So, making gradual adjustments is key. Taking stock of where you are and maybe choosing one of these areas to focus on and making small changes until you get to where you want to be in that area. So, not expecting these things to change overnight. No pun intended, but really working with where you are and gradually making improvements until you are where you want to be. And so here's an example of what that might look like, and we can work backwards. So first, you're wanting to think of what time you want to wake up in the morning. So 6:30, whether that's to get ready for work, get your kids ready for school, to take an early morning walk, whatever the case may be, but thinking about what time you want to wake up, subtracting your 7 hours of good quality sleep from that means that you want to fall asleep by 11:30 p.m. And then you're thinking of how long it takes you between when you get in bed and when you fall asleep. So that's what we call sleep latency. Again, that's different for everyone. It can range from 15 minutes to a half hour. It can be longer if you're having sleep difficulties. But if it's, say, 15 minutes here, that means we want to get in bed by 11:15 p.m. And then you want to think about your wind down routine and how long that takes. So if you're spending a couple minutes tidying your house, maybe doing a 10-minute relaxation yoga and spending 5 minutes journaling, you might have a wind down routine that lasts about 20 minutes. So that means you want to start that routine at 10:55 p.m. So that time should be in your mind as the time to turn off TV, other devices, and really start focusing on the process of winding down and getting into sleep. Another area that you can focus is on scheduling your daytime activities. So, things that you do during the day can absolutely have an impact on your sleep quality. So, one is to try to get exposure to sunlight in the morning when you wake up. And so, again, this is trying to activate your body's circadian rhythm, your circadian regulation system, which is dependent on input from light. So, sometimes this happens naturally. We're woken up blissfully by the sun coming through our window. But this can be really difficult on days that are overcast, and especially during the winter when it's dark late into the morning. So, one thing that people sometimes find helpful is kind of these artificial lights. So, I have one that I use, especially during the winter. It's meant to kind of mimic sunlight, and you can use it for 20 to 30 minutes when you wake up. You can have it off to the side as you're getting ready. You can have it up when you're eating breakfast. But that really helps to kind of activate you in the morning. Incorporating physical activity into your daily routine, even moderate intensity activities like a 20-minute walk, can be really helpful, not only for improving your sleep, but also for decreasing fatigue. Avoiding caffeine in the afternoon and evening. So, caffeine can have effects anywhere from 3 to even 6 hours after you ingest it. So, really taking a moment to assess that afternoon cup of coffee and how that might impact your sleep. When it comes to meal timing, eating dinner no less than 3 hours before bedtime, because you don't want your digestive system to be active right when you're trying to fall asleep, because that can also really disrupt your sleep cycle. And then thinking about how to improve your sleep environment. So, when you look at your bedroom, thinking about yourself in your bedroom, is it somewhere that's conducive to sleep? Is it somewhere that, you walk in and you think to yourself, oh, I could fall asleep here? So, thinking about your mattress, your pillow, your bedding, thinking about the temperature. So in general, cooler temperatures help us sleep better throughout the night. So about like 63 to 65 degrees. Blocking out light and noise. So this can differ depending on what else is going on in your home, if you and your other family members have different schedules. But things like a white noise machine might be helpful. If there's ambient noise, or some people have trouble falling asleep in complete silence. So sometimes just kind of background noise can be helpful in helping people fall asleep. And then importantly, using your bed only for nighttime sleep. So if you're taking a nap, taking a nap somewhere else, on a couch, recliner, the guest bed, and then also trying to avoid doing other things in your bed. So trying not to do work in bed, trying not to eat in bed. So again, you want to train your mind and your body to associate your bed with sleep. And then also trying to take the pressure off. So, one thing that a lot of people do is spend a lot of time in bed ruminating on not being able to fall asleep. So, thinking to themselves, oh my goodness, it's 5 a.m. I only have 1 hour before I have to get up. I'm not going to be able to fall back asleep in time. I'm going to be groggy when I wake up. So as much as you can, keeping the clock out of sight, keeping your phone away from your arm's reach so that you're not able to kind of do that clock checking. And then also, if you're awake in bed for more than 20 minutes, get out of bed. Again, that's to help keep your bed associated with sleep. And you don't want your bed to be associated with those negative thoughts about difficulty falling asleep or frustration about falling asleep. So if you're in bed for more than 20 minutes and you're awake in the middle of the night, try getting out of bed, turning on a low light, doing something like reading, something relaxing, writing, and then trying that for maybe about a half hour, getting back in sleep and getting back in bed and trying again. So that's another strategy you can try. And so all of those are things that you can do more or less on your own at home. If you're looking for specific treatments for some of these sleep disorders, there are definitely options. So one is cognitive behavioral therapy for insomnia. And so in addition to all of those strategies that we've talked about, CBTI also incorporates a strategy called sleep restriction. So if you're in bed for 8 hours and you're only sleeping for 6 hours, CBTI says, okay, if you're only sleeping for 6 hours, only spend 6 hours in bed. And what we find is that over time, kind of restricting that window of sleep that we're allowing helps people fall asleep quicker during that time. So you might find yourself being more tired throughout the day, but that's actually good because you'll have that much easier of a time falling asleep and staying asleep. And then gradually over time, that sleep window extends. So that's how CBT for insomnia works. If you have sleep apnea, the CPAP device can be helpful for that. Also, the most consistent finding in research is that regular physical activity, especially more relaxing forms like yoga, can be helpful for sleep. And then there are also different medications, especially for things like restless leg syndrome. There are also medications targeting insomnia. I'm not a physician, so that's all the detail I'm going to get into about that. But you can ask your doctor about those types of things. And then some resources and recommendations for further reading or resources if you're interested in pursuing any of those treatments. So, the American Cancer Society has a great website about sleep and cancer. VCU Health has a center for sleep medicine. If you do need testing for things like sleep apnea or for diagnosing sleep problems. I'll also put in a plug for clinicaltrials.gov. So there are right now, I just looked up before this meeting, 45 trials that are currently recruiting specifically for sleep interventions in a cancer population, including one at VCU that focuses on people with brain tumor. And some of those other trials may be remote. So you may be able to participate even if you're not in those locations. So those might be worth taking a look at. And then lastly, but not least at all, talking to your doctor about these things. Another consistent research finding is that sleep problems are one of the most common things that people with cancer experience, but it's also one of the least common things that they discuss with their oncologist or other doctors. So bring these things up with your doctor, and they can help connect you to other resources, or they might be able to help you by prescribing medication, adjusting the medications that you're currently on. So definitely something that you want to discuss. So that is all I have prepared. If you have questions, you can get in touch with me via email or social media. And then Susan, I'll turn it over to you for any questions that came up while I was rambling.
Okay, well, certainly you weren't rambling. That was an excellent and comprehensive overview of sleep.
Thank you.
I certainly learned a lot, and I had to laugh when I heard you describe the clock watching, that panic that, I only have an
Yes.
hour left to sleep.
Mm-hmm.
One of the things you mentioned was sleep efficiency.
Yes.
Is there a number for what might be considered a baseline for sleep efficiency?
Absolutely. So, what we consider good sleep efficiency is 85%. So, if you're looking at your time asleep divided by your time spent in bed, you want that number to be at least 85%. So, if it's below that, you might look into some of these strategies. And if it's above that, then you're on the right track.
Okay, thanks.
Mm-hmm.
That's good to know.
Yeah.
What would be your recommendation for someone who gets a low percentage of deep sleep and REM sleep compared to people of similar gender, age, and BMI?
Yeah, so that's a good question. And that kind of gets into the more in-depth polysomnography testing.
Mhm.
Things like those sleep stages, we don't really have access to analysis by those wrist-worn monitors. So that's something that you might look into getting a sleep study for. And there are a variety of other sleep disorders that I haven't mentioned in this presentation just because they're less common. But there are things like hypersomnolence, narcolepsy, circadian sleep disruption. So if you know through a sleep study or something like that that you're not getting deep restorative REM sleep, that's absolutely something to bring up with your physician, and that might require some specialized treatment.
Another question we got was, how do you feel about reading on a Kindle, the paperwhite Kindles?
Yeah.
With the lighting, the lighting is adjustable on that. If the lighting is set on low for about 15 minutes in bed before falling asleep.
Mm-hmm. Yeah, so there are two types of the Kindle. There's one that's like the paper white, where it's
Mhm.
minimal lighting and it's actually like you're just reading a book. And so you would have like maybe your nightside lamp on and your Kindle, and it's just kind of like the same experience of reading a book in bed. Absolutely fine. There are other Kindles that have like it's like an iPad or something with the backlighting built in. So if you're having that on low light, but not low enough that you're like straining to read.
Mhm.
But if you're having that on low light and it works for you as kind of your sleep routine to read before bed, if it's working, then keep doing it. If you are
Good.
still having trouble sleeping, that might be time to investigate either the different type of Kindle or a paperback or a physical book and seeing if that helps at all. But in general, if you're doing these things and you're not having sleep problems, then in a lot of cases, there's no reason to change or alter what you're doing.
Great. That's good to know.
Mhm.
You mentioned the impact of insomnia on caregivers.
Yes.
And, I had never considered that, as I'm sure other people had not considered. But when you said that there were patterns were similar,
Mhm.
a little scary, but it
Yeah.
makes perfect sense because if one, especially if their bed partners, is not getting deep rest, then it would make sense that the other would not also.
Exactly. Yeah. So if, for people who are undergoing cancer treatment, there's a lot of reasons why they might not be getting good sleep. There's a lot of reasons why they might be getting up in the middle of the night. A lot of oral chemotherapies you have to take, drink so much water with. You might be up several times throughout the night using the restroom. And so those awakenings might be affecting your bed partner, but also some of the same concerns that the person with cancer has, their partner is having, all those same anxieties, emotions. And so the fact that those are happening in parallel really does make sense. And so everyone is different, every relationship is different. But there's no reason to not have a discussion about, if one person is keeping the other person up, maybe, spending some time, sleeping in the guest room or having separate sleep situations. There's nothing that says that's, against marriage law or, out of the question. And if it's
Yeah.
going to benefit the both of you, it may be worth a conversation. So that could also be something to think about.
Absolutely. And the final thing I'll bring to your attention is I loved how you explained the difference between sleepiness and fatigue. We hear so often amongst our cancer population that fatigue is such an overarching symptom
Yes.
treatment. Yet it's great the way you explained it. That it's not just sleep deprivation, that
Mhm.
it's actually physical weakness. I had no idea.
Yeah, absolutely. And so sometimes when people are describing fatigue to their physicians and maybe don't have the right words or to fully describe what they're experiencing, doctors might interpret that as lack of sleep, or there might be something lost in translation there. So I do think that there's or even when you're trying to explain it to friends and family, people who don't have that experience really can't kind of conceive of how all encompassing that fatigue can be. So sometimes it can be frustrating when you get advice like take a nap or make sure you're getting enough sleep, because fatigue might not be responsive to those types of things.
Absolutely. The overarching thoughts I had during your presentation was it's so important for our patients to communicate with their doctors, to let them know they're
Mhm.
experiencing fatigue or they're experiencing sleep disruptions, whatever it may be.
Absolutely.
So, what would your overarching, if there was one thing you'd like for people to take away from this talk today?
Yeah, I think not to copy you, Susan, but that is similar. My takeaway is for people to not dismiss their sleep
Mhm.
problems just because it's a common experience throughout for people who have active cancer, are in survivorship, surveillance, for caregivers. Just because it's a common experience doesn't mean that you have to live with it as a problem or a difficulty. And I really am struck by the consistent research findings that so many people have this experience and so few bring it up to their doctor. And that might be for a variety of reasons. There may be other things that seem more pressing or more urgent or are larger problems. But if you have a list of things you want to talk to your doctor about and you're having trouble with sleep, make sure sleep is on that list. And there may be very simple things that your doctor can do for you, whether it's, if a medicine that you're taking at night is keeping you up at night, they may be able to prescribe that to you in the morning. And so it may just be a very brief conversation, or they might have some referrals to other providers, or other medications that could help. So it really is worth that conversation. And I think everyone owes it to themselves to do whatever they can to get good, consistent quality sleep.
Dr. Lanoye, thank you so much for sharing your expertise and your time. And I hope that the population out there will gain something from this and
I hope so
understand
too.
how important sleep is, not just during the cancer experience, but to us all every day. Thank you again so much.
Absolutely. Thank you too. It was great to be here.